Markets in Africa have traditionally played a very important role in buying and selling of goods, especially agricultural produce. But in Kenya, precisely in Vihiga County in the western part of the country, markets are today increasingly offering more than this.
Markets are major convergence zones for community members where people from all walks of life tend to converge, and mostly in the rural areas. So we felt it provided an environment with which then we could leverage on in pushing for prevention of non-communicable diseases.
With Kenya experiencing a steady rise in cases of non-communicable diseases that include diabetes, hypertension, mental health and cancer, this unique and innovative health service delivery module, known as Health Kiosks in Markets, or Hekima, is turning out to be very successful in improving access to preventive care at community level by providing free screening services for cardiovascular disease factors such as obesity, high blood pressure and diabetes.
Hekima clinics are free clinics. You walk in at any time from 8 to 5, they're open. You'll meet our CHVs, our staff around here. There are no payments. You take your blood pressure, you take your weight, you take your height, free of charge. It has been very beneficial in reducing the burden of hypertension and diabetes in the community. I'm sure more people could be identified, and if treatment is started earlier in hypertension, diabetes, it is good for the patients because now we are able to prevent the complications which are very expensive to treat.
With markets being a central locus of life in many rural areas of Africa and gathering points for people of all ages and backgrounds, locating of these health kiosks in such trusted community assets has increased the successful uptake of health promotion by vulnerable members of the community.
People have been coming in queuing to know about their health and about non-communicable disease. So it has been very much beneficial to this particular market and the community.
We've also seen an increase in the number of referrals and traders, customers who are visiting the market and getting to visit the healthcare kiosks to know their status.
Health Kiosks in Markets initiative is not only creating awareness and providing screening services for cardiovascular disease risk factors such as obesity and high blood pressure, but also imparting knowledge through health promotion talks and equipping the trained community health volunteers who are supervised by nurses with adequate information and materials to be able to pass that knowledge and information to the public.
For those who are found to be at risk of developing, let's say, cardiovascular disease such as heart disease or stroke, they are then referred for further care. And for those who are in the risk category, then they are followed up and provided with lifestyle advice to help reverse those particular conditions.
Mwili ilikuwa na pressure juu sana, ilikuwa na 200 na chini. Saa hii najivunia kliniki inanisaidia. Saa hii naenda kanisani, saa hii naweza tembea hata kutoka hapa nifike Mdete, lakini singeweza kuenda Mdete. Na imesaidia wamama wengi sana, wamama kwa wazee, kwa watoto, kwa wasichana, imewasaidia.
Developed by researchers at the Kenya Medical Research Institute, KEMRI, King's College London, Strathmore University and the County Government of Vihiga, among others, today these health kiosks are very popular and are fully integrated into market setups in Mudete and Chavakali markets in Vihiga County and are playing an important role in offering preventive care to rural communities with lower socio-economic status but facing difficulties in accessing healthcare, and thus less likely to go for checkups and remain vulnerable to the onset of cardiovascular diseases.